Welcome to Wellness Way USA podcast. I'm Lori Newcomer, integrative health coach from Duke University, and today we have Dr. Robert Corvino, and our topic is irritable bowel syndrome. So, Dr. Corvino, could you tell us more about that, exactly what it is? Because I think there's some misperceptions out there because it seems to be a commonly used diagnosis.
Yeah, absolutely. So it is actually a very commonly used diagnosis. So IBS, for short, is actually a diagnosis of exclusion. So what that means is IBS is a diagnosis that's given when, I guess, no diagnostic criteria is really found. So what I mean by that is when they run all the tests, right, when they're looking at, your colonoscopy, endoscopy, what they're looking for is they're looking for any type of marker that's going to tell them specifically what disease it is.
Like a Crohn's disease or something.
Exactly.
Okay.
Now, if they don't find Crohn's, if they don't find a tumor, if they don't find an ulcer, then essentially what they're doing is they're saying, well, there's still something going on, right? There's still pain, there's still discomfort, nausea, diarrhea, constipation. We're going to label this irritable bowel syndrome. And that's ultimately how that diagnosis comes about.
Okay. Is it bad for me to say that seems kind of like the easy way out? Or is it just the safe way? Or?
It's not bad. It's just that gastrointestinal conditions are so broad.
Okay.
And because the GI tract is such a sensitive area, there's a lot of people nowadays who have very, very bad gastrointestinal discomfort. And what happens is there's actually so many people that go into their primaries when they have this discomfort that you can't always find a problem. So at the end of the day, when there is no functional diagnosis to be made, that diagnosis of exclusion, IBS is essentially what is labeled.
Kind of what's left over.
Exactly.
So what exactly is the difference between the IBS and the IBD, the syndrome and disease?
Yeah, absolutely.
Right.
So IBS is going to be, like we talked about, it's that diagnosis of exclusion. IBD is going to be when they find a biomarker.
Okay.
Right. So when they find a marker that tells them specifically what condition it is, that's going to be IBD. So IBD is something like ulcerative colitis or something like Crohn's disease.
Or I guess, does lupus fall into that category?
I don't believe that lupus.
No, okay.
I believe lupus would be under autoimmune.
Okay.
Yes. So yeah, IBD, really the main difference is you're not looking anymore at essentially just discomfort. Now you're looking at this gross abnormality. You're looking at actually tissue damage. You're looking at things that you can actually see under a microscope.
Okay. All right. What causes some of these conditions, IBS or IBD? I guess IBS more is our topic today. So what causes that? Is it genetic or is it something that you just, can you do it to yourself? Or
Yeah, so that's a really good question. And honestly, the answer is really broad. So this has kind of been a question that has been researched for the last couple decades. IBS is something that to this day, we still don't really know the etiology or the origin. So there's a bunch of different ideas of what causes it. But what we've come to the conclusion of is that it's multifactorial, that there are a bunch of different components to the creation of the disease. So one of the very, very simple explanations is microbiome. So your microbiome is essentially the beneficial and unbeneficial flora within your gut. So what happens is over time, based on the way that you're living your lifestyle, based on the way that your diet interacts with your body, you're going to change balances in these levels. And as those balances change, what happens is when this unhealthy flora starts to rise, it creates symptoms. And it creates symptoms of nausea, discomfort, bloating, all of these very common IBS-like symptoms.
so it's something that you could actually build up over time. Like you're not really sure what's going on, but something's not right and you don't realize it till years later, or?
Yeah, absolutely. And especially with the way that, our first world American, that Western world diet exists nowadays, right? Very pro-inflammatory, very high in processed foods, refined grains. We're really impacting our biome every day with what we eat and with the way that we're living. right? So it's actually very easy to negatively impact our biome, and that Western diet plays a huge role.
Now, I want to ask kind of maybe some techniques that you use to treat that. But first, is there a test or some lab work or some type of blood test that they can do to kind of clarify the condition or to help you
Yeah,
diagnose it?
absolutely. So traditionally, when it comes to irritable bowel syndrome, now this condition actually plays into my passion, and the reason for that is because I had a lot of people in my life, a lot of family members, a lot of friends that had really bad irritable bowel syndrome, and one of the reasons I really got into essentially supporting this condition is because I saw a lot of people who had very bad symptoms, in my opinion, never get the help that I believe they deserved. So what I wanted to do was I wanted to really find what is going to help them get rid of these symptoms, what is going to help them essentially get rid of the origin of the condition. So typically when you have symptoms like this, what they're going to do is they're going to run a typical panel of a couple tests, right? So they're going to do something like an endoscopy, which is where they're putting a microscope into your esophagus. They're looking for any type of lesion. Same thing, colonoscopy, which is opposite, and they're looking for any type of gross abnormality or lesion. Looking for stool, for blood in the stool. Looking for different biomarkers that are essentially these major damaging changes. Now, if they don't find any major damaging changes, they're not saying that there's not something wrong, but at that point, they're actually not finding what's the issue.
Is that kind of whenever they go instead of IBD, they leave it at IBS, kind of like
Yes.
their
Yes,
default?
exactly. So if there's, for example, no presence of ulcerative colitis, no presence of Crohn's disease, if there's no presence of like a gastric ulcer, duodenal ulcer, even something esophageal, then they're going to label it more as either an IBS or as maybe if it's in the esophagus, like a GERD, which would be esophageal reflux, something like that, because what they're doing is they're not finding any major changes to make a functional diagnosis.
Okay. So let's say a new patient comes to you,
Mhm.
someone that's watching this, and they come see you at a race strength, and my doctor has said IBS, they can't find anything wrong, but it's killing me. What do I do? And say you did all your lab work and stool samples and blood work and all of that. I know everybody's different, but in this situation, kind of what is your first step to move forward to kind of help them?
Yeah, that's a great question. So when it comes to sitting down with someone who has a condition like this, the first thing I'm going to do is I'm really going to run through that complete history. I want to know exactly when did this start and ultimately why. Most of the time when you sit down with someone, you can figure out at least a hypothesis of why it started. Now, the lab work I'm going to run, what I'm looking for is I'm looking for any origin of gastrointestinal inflammation. So there's a couple big major things that can cause increases in inflammation in the gut. Some being hypersensitivities or allergies. So there's a couple different panels that will test for allergies. There's a couple different panels that will test for sensitivities. But ultimately, when the body responds to a molecule that is essentially tagged as an allergen, it creates an inflammatory response. That inflammatory response then ultimately, if it's not controlled, can cause damage to the surrounding tissue. And most of the time, that's going to be an origin for a condition like this. Now another type of test that I would run is a stool test. And what I'm looking for there is I'm usually looking for any major bacterium, fungus, yeast, or parasite that could potentially be driving inflammation in the gut as well.
Now they can also have maybe an allergy or allergic of some type to a certain food or ingredient. That could cause this as well?
Yeah, absolutely. That's actually really common. So what I've found just from the people I've worked with is gluten. Gluten is a major allergen, and what they've actually found in the research is that in some studies where they actually measured the changes in inflammation based on intaking gluten, they actually found that 100% of the participants had some sort of inflammatory response.
Yeah, that's what I've heard, that gluten kind of is, and it's been around. I heard gluten 20 years ago, but now it seems to be a lot more commonly used.
Absolutely.
And a lot of restaurants accommodate to that, the gluten-free, diets and stuff. I know there's triggers, alcohol and things like that, as well as gluten, but what is a common trigger that you would say for someone that's having some stomach issues, or to kind of stay away from, something they could do for themselves right now?
So when it comes to what to avoid, that's all going to be based on presentation. So what I usually recommend with people is do some sort of elimination diet. So an elimination diet is essentially what you do is you go on a 21-day hiatus where you're going to slowly eliminate foods from your diet. And then when you re-put them into your diet, you're going to find if you have a reaction to that food.
Wow, so that's a pretty long process. So you're saying like cut a handful of things, say it's raw vegetables or something specific, and then as you start to add each one in after that, you see if it aggravates you?
Yep.
Now, is there at Array Strength, now is there a test that you could do, like the stool test or something, that could kind of do that whole process for them a lot easier?
Yeah, so
speed it up?
So when I'm working with someone, really easy for you to do at home would be that elimination type diet. The reason I don't use that is, like you said, it's timely. Sometimes it can take 2 months to find out everything that you're having a response to. So what I run is I run a panel which is known as IgG, IgA. So what those two molecules are, they're both immunoglobulins that are essentially released when you have a more low-level inflammatory response. So what they're looking for is they're looking for any of these more minor, slower inflammatory responses that are being caused by the gut. And what they'll find is they actually test 96 of the most common allergens, and it will give me a full panel of everything that the patient is actually having a response towards.
Oh, and kind of what level of extremity, or
exactly.
Okay.
So that shortens the time frame a lot. So rather than doing that whole 21-day elimination diet, it's a lot simpler.
So what like complex condition that you feel needs professional help, that you would just direct someone, say go see your doctor or GI or get a referral? What do you feel?
What I would recommend is, when it comes to gastrointestinal conditions, they're so all over the place. I would say if you've tried, the typical recommendations, the probiotics, you've changed your diet. That's actually, something. Before I continue, I want to touch on this. It really comes back to the essentials. The biggest thing that I've seen when it comes to gut health is a lot of people want to supplement probiotics. They want to supplement glutamine, right? They want to supplement colostrum, all of these well-known IBS type supplements. But at the end of the day, the biggest thing that impacts your gut is just simply going to be your diet.
Your food, yeah.
So coming back to that whole food diet, gluten-free, making sure you're getting these leafy greens, high-quality multivitamin, just packing your body full of nutrients. Most of the time when I'm working with someone and I get them doing the essentials right, typically about 80% of their symptoms actually reduce.
I have to say, I am a patient of his, and just in the startup process here, I've seen change as far as just stomach cramping and bloating and things. So I have to say, yes, you're on the right track.
That's
so, anything else that you would like to end on today regarding irritable bowel syndrome, or anything to kind of encourage them to see someone, or at least research it and change in their diet?
Yeah, absolutely. I think the biggest thing when it comes to gastrointestinal conditions is people lose hope, because they've had it for so long and they've seen everyone.
They just think that pain's normal, and
Exactly.
It's kind of just accept it.
So I just want to encourage everyone, who's watching, that there is hope. There are things that you can do. There are people that you can see, and finding more of a functional practitioner who's willing to work with you on diet, or willing to work with you on lifestyle, willing to work with you on these major stressors and mental health, there is actually hope for these types of conditions, and you can ultimately see really good results.
Awesome. Thank you so much for your time.
Yeah,
Again, it's
thank you.
Dr. Robert Corvino from Array Strength. And thank you for joining us, and we'll see you next time.